Hi, this is Christina Herrero. I'm an orthopedic resident at NYU Langone Orthopedic Hospital, presenting an ultrasound technique guide for the evaluation of developmental dysplasia of the hip performed by Dr. Pablo Castañeda. The ultrasound of the newborn should be performed in a dark, quiet room with adjustable lights that will have minimal interruption. Have a warm blanket for the baby and ideally warm ultrasound jelly. You can use traditional ultrasound or a point-of-care ultrasound machine as seen in the video, as long as it obtains high-definition images. After a full well baby physical exam and inspection of the pelvis and lower extremity, start the hip ultrasound exam, keep the baby in their own blanket and clothing, and only unwrap and evaluate one hip at a time. The first step is to evaluate whether the hip is reduced or dislocated. With the baby supine, hold the hip in 90 degrees of flexion and 10 degrees of internal rotation. Place the transducer parallel to the long axis of the femur and evaluate the relationship of the femoral head and the acetabulum. This will produce a transverse image. If the femoral head is seated next to the acetabulum, regardless of whether it may be dysplastic, the femoral head is reduced. Then you will determine whether the hip is stable. Adduct and apply stress superiorly and posteriorly, simulating a Barlow test under ultrasonographic examination. Displacement of the femoral head during this maneuver represents instability. There are two methods to assess displacement sonographically. One is to measure the distance between two set points, typically the femoral head and the triradiate cartilage. Displacement greater than 4 millimeters between the acetabulum and femoral head signifies instability. The second option is to look for the burden flight sign, which is a line drawn along the acetabulum and along the proximal femoral metaphysis. This virtual line is akin to a Shenton's line on a radiograph and should be contiguous. A broken line signifies an unstable hip. Finally, you will determine the hip morphology. Rotate the transducer 90 degrees to obtain a coronal view. This produces an image analogous to an AP pelvis. To accurately assess acetabular development, these coronal images should be captured with a perfectly flat ilium from which measurements can be constructed. To measure acetabular depth, a line is drawn along the lateral border of the ilium. This line should intersect the femoral head with at least 50% of the head inferior to the line, with smaller values suggesting dysplasia. A second line is then drawn along the bony acetabular roof to the triradiate cartilage to construct the alpha angle. The alpha angle should measure at least 60 degrees by 4 weeks and subsequently increase with age. A third line is drawn along the cartilaginous acetabular roof to the labrum, also branching from the triradiate cartilage, creating the beta angle. This should be no more than 55 degrees, with increased angles representing increased severity of subluxation. Repeat all steps for the contralateral hip. All measurements are described in further detail in our written technique guide and should be performed after the completion of the ultrasound hip exam.
The technique described here is an ultrasound-assisted exam of a patient in a Pavlik harness. Similar to our prior patient, you should begin your exam in a dark, quiet room. The goal here is to determine whether the hip is reduced when in the harness, so the exam must be done with the patient in a supine position to allow the hips to fall into abduction. The first step is to determine whether the hips are reduced or dislocated. Attention can be directed to the ultrasound machine to determine whether the femoral head is seated within the acetabulum. Next, the hip is stressed to determine stability. A Barlow maneuver is simulated with posterior stress, and any displacement of the femoral head is indicative of instability. The transducer is then turned 90 degrees to simulate the view of an AP pelvis and assess acetabular depth. Measurements described in the previous video and our technique guide can be performed after the exam. All steps are then repeated with the contralateral hip.